Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have an email from Anthony who says, "Hi Patrick, please help. Tomorrow the doctors want to end life support after only 4 days in ICU for my 35-year-old sister. She has been in perfect health, no pre-existing condition. Suddenly she went into cardiac arrest 4 days ago. She had CPR within 2 minutes. The EMTs brought her back to stable after another 8 minutes. Apparently, she has an anoxic brain injury. Arrival to ICU first, vitals pressure looked amazing, the nurse told us. Now the doctors are saying no need to continue life support. I can't live knowing I didn't try anything to save her life. The doctors say they have no idea what happened. I don't believe them at all." From Anthony. Thank you, Anthony, for sharing your sister's situation. It sounds extremely dramatic and extremely sad. Now, withdrawing life support against family consent, if a patient can't give consent themselves, is always premature, in my point of view. People always need to have a say if there is an end-of-life situation, how they want to end their life. It's about quality of end of life. Now, how can anybody possibly predict that after 4 days in ICU, your sister is not getting any better after maybe weeks, months, years? Who knows? The one thing is for sure, if they stop life support tomorrow, she will be dead, and there is no return from that as far as we know, but even there are different opinions on that. In any case, you should not give consent to withdrawing life support. Once again, 4 days in ICU is way too early. You need a second opinion. You need someone like us here at intensivecarehotline.com to look at medical records. You need someone to give you hope, right? Because once again, after 4 days in ICU, it is way too early. It would be way too early after 8 days in ICU. It would be too early after 80 days in ICU. It's not all options have been looked at. And why? So if they, why would they stop life support on someone that they can keep alive at such a young age? That doesn't make any sense to me whatsoever. Do they need an ICU bed? Do they have pressure on their ICU beds? Do they have pressure on their ICU resources? Is your sister on high doses of life support besides the ventilation? Is she on high doses of inotropes, vasopressors? Is she on ECMO after cardiac arrest? Is she on a balloon pump? You haven't mentioned any of it. How are they supporting her? But irregardless, it is too early. My advice is that after having worked in intensive care for nearly 25 years in 3 different countries, where I also worked as a nurse unit manager, and where I have been consulting and advocating for families in intensive care for nearly 11 years, since 2013, all around the world. And we have saved many lives with our consulting and advocacy, because we are specialized on patient and family rights in intensive care. So, we haven't really had a client that had treatment withdrawn against family consent because of our advice, because of our advocacy. I can say we have a 100% success rate, with the difference that if clients don't follow our advice, that's when things go pear-shaped. But if clients do follow our advice and they work closely with us, we always can turn these situations around, and we always have. There's also a podcast where we have a client testimonial about that, how we turn a situation like that around, and we've done it many times over and over again. So there is a proven concept. So in any case, you should be making decisions today that you don't regret in 12 months' time. Do you think you might be regretting giving consent to withdrawing life support on your 35-year-old sister? I think you would. We have many families reaching out to us saying, "Hey, my mom, my dad, whoever passed away last year in ICU, we gave consent to quote unquote pull the plug, withdraw life support. We didn't know there were consultants and advocates out there. We just thought ICU team knows everything. Well, you know, I'm a big believer that God gives life and God takes life. And in the meantime, you've got to do your best to live life and to keep people alive, you know, and that's my belief. What is your belief? What do you want for your sister? And it doesn't sound to me like you want for your sister to die, you know, and that's what you should be advocating for. But we can give you all the in-depth insight, you know, how to do it. And also you should get access to the medical records, you know, and you need a second opinion on this very, very urgently. You know, people have recovered from anoxic brain injuries, have improved, you know, and because especially you're saying that blood pressure looks okay, that means she's probably not on inotrope. So the only form of life support your sister might be on is actually the ventilator, right? That's the only form of life support she might need to be weaned off. And, you know, if there are discussions around quality of life, you know, that she won't have any quality of life. Well, what is quality of life? That is in the eye of the beholder. It is not up to anyone to judge anyone's quality of life. It is up to the eye of the beholder. Also, there's plenty of time to talk about end of life. Plenty of time. What's the urgency here to talk about end of life? What's the rush to kill someone? Right? What is the rush? So plenty of questions that need to be asked, and we can help you with that, turn the situation around. That's also why we created a membership for families of critically ill patients in intensive care at intensivecarehotline.com. When you click on the membership link, you can get access there, or you can go to intensivecaresupport.org to become a member of our membership for families of critically ill patients. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I make sure you make informed decisions, you have peace of mind, control, power, and influence. And I'll make sure your loved one gets best care and treatment while they're in ICU. We also offer medical record reviews as part of our membership and as part of our phone consulting and advocacy, so that you can have a second opinion in real time, and so that you can make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams, making sure you know what to say, you know how to say it, you know what not to say. You know, once again, all with the goal of you making informed decisions, having peace of mind, control, power, and influence to make sure your loved one gets best care and treatment. In our question today from Anthony, his sister certainly doesn't get best care and treatment if they are wanting to withdraw life support after only 4 days in ICU. We also offer medical record review after intensive care, if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live. Get on my email subscriber list at intensivecarehotline.com, and you'll get notification for the weekly YouTube live where you can ask questions live on the show. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.